The main reason is the coordination of all the services, like see the eye doctor, the foot doctor, and dietitians and all that.
I've seen more of an interest in their own condition. I've certainly taken a bit more notice of mine, and through the physio part of it, we're actually now going to start going to buy a bike. We're going to buy a recumbent bike, which is not something I was aware of, but through that physiology thing, yeah, we've actually started moving towards doing something a bit extra. It's one of those conditions that you can't see, therefore you're not sick. And so becoming a little bit more aware of what can happen to you if you don't sort of, clean your act up a bit.
For me, because I've been diagnosed with it since I was about 25 years old. And I did an 8-week program when I was 25, which was very, very rigid. You can't eat this, you can't eat that, don't do that, you've got to eat every 2 hours, blah, 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 blah. This is a lifetime sentence, you're in really dire straits, blah, blah, blah. So I spent years and years and years just, no, I'm not going to be a diabetic, I'm going to have holidays whenever I feel like it from being a diabetic, and I'm not going to stick to all of this, and I'm not going to do it, it's just all too hard. I had little bits of information throughout the years, little bits and little bits and little bits to try and put it all together, but there were still things that I didn't know, and that's, as I said, 20 years down the track, still stuff I don't know. Didn't understand how the sugar sticks to your walls of your arteries and things. I thought because my cholesterol levels are so good, didn't have to worry about any of that hardening of the arteries. I wasn't going to have heart attacks. I wasn't, because my arteries are good. So that was something that really spun me out. That all these years I didn't know that. I now know that.
I have great difficulty avoiding Anzac biscuits, but I with my test with Lynn, the diabetic educator, I like her approach, and she's convinced me with we've altered some of the insulin rates, we've altered that a little bit, and we've dropped some of the tablets as a result of what Lynn suggested.
Getting me on to specialists, like getting some special shoes made.
Having all these services together is brilliant. It means that you really can get in there and do things that you need to do for your own health.
I now know that my feet are okay. I now know that things with my diabetes, some things are good and some things I really need to get a handle on. So instead of just going off there thinking, well no look, my kidneys are fine and this is fine and that's fine, I don't have to really stress about this. I now know there is so many other things I need to stay aware of, try a lot harder than I have been trying in the past to keep things under control. Yeah, and it's all good.
Starting to keep appointments, do your blood sugar levels, do your blood tests every 3 months, all that sort of stuff.
I'm buying different types of food at the moment. As I say, I haven't bought an Anzac biscuit for 18 months, which is an achievement for me.
I check my sugar a little more often. I was only ever just borderline, so I've noticed that if I don't eat, my sugar doesn't go up. Therefore, now having to do more portion control, a bit more exercise, and do my sugars a little bit more often have helped a lot. I'm so pleased that this program is going, because there's so many people out there who need the education, and they don't seek it out, they don't see that anything's wrong, and then it becomes too hard. They don't know what to ask, they don't know how to go about it. So I hope it goes on a lot longer too, and something really positive comes about it.